But what if they regret their decision to get their tubes tied? Is what a lot of people are going to say when we talk about sterilizing younger child-free adults who are asking for these procedures. A new study has been published that's really showing the opposite, that younger patients who get sterilized really have low risks of regret after having this procedure done. This study surveyed over 400 participants who'd either already gotten their tubes tied or were interested in the procedure. The study looked at reasons that patients were seeking sterilization, the top causes being not wanting children, not wanting to parent, and being fearful of childbirth. A large majority of these patients were also interested in sterilization for financial or environmental reasons. 38% of the respondents had already undergone a permanent sterilization procedure. And of that 38%, 99% of them responded that they strongly agree that this procedure was the right choice for them. Unfortunately, 47% of those people who had gotten the procedure done had to ask more than one physician for the procedure. I do think there are a couple limitations with this study. The first one being that the patients who are filling out these surveys likely have very strong feelings about sterilization. And I also would really love to see long-term follow-up with these patients. Survey them again in 20 to 30 years to see if their opinion changes. That being said, I hope that this data continues to make OBGYNs think about how important it is that we listen to our patients about getting sterilized, especially if they're younger and child-free. These patients know what they want, and it's our job to support them in that. And as always, if you're having a hard time finding a physician who will help you, I have a list of almost 3,000 gynecologists who will.